If you're considering Kegel exercises to improve your erections, you might be making a big mistake. Many men believe Kegels will make them rock hard, but for some, they can actually make things worse. Instead of better erections, you could end up with a problem that's even harder to fix. As a urological surgeon and sexologist, I've seen countless cases where men unknowingly worsen their condition with Kegels. So before you start, let's break down whether these exercises are right for you, or if they could be ruining your erections. Okay, so, you all understand what Kegels are, right? That's why you've clicked this video. But for those who don't know, these are exercises designed to strengthen the pelvic floor muscles by repeatedly contracting and relaxing them. They are commonly recommended for both men and women to improve bladder control, sexual function, and core stability. Now, I don't know why every man thinks that in order to stay longer in bed, every man needs to practice Kegel exercises. Now, I think you're doing a huge mistake. Why? Because most men don't actually have weak pelvic floor muscles. Instead, they have the opposite problem, an overactive pelvic floor. And tight, overworked muscles can create the illusion of weakness, leading to symptoms like poor erections, premature ejaculation, pelvic pain, and sometimes difficulty urinating. I know this because I've performed thousands of pelvic exams. In younger men, true pelvic floor weakness is rare. Instead, the muscles are too tight and unable to relax, which reduces their ability to contract properly. The issue with Kegels is that they are often misunderstood and misapplied. The most common problems associated with excessive or improper Kegels include pelvic floor dysfunction. A study published in the International Urogynecology Journal found that overactive pelvic floor muscles can lead to chronic pelvic pain, urinary urgency, and painful intercourse. Why? 'Cause Kegels overwork the muscles, causing them to become too tight and unable to relax properly. How? Well, your pelvic floor muscles are skeletal muscles, not smooth muscles. That means they function by contracting and relaxing. When a muscle is overactive, it stays in a permanently contracted state and can't relax properly. Now imagine taking a muscle that's already too tight and forcing it to contract even more with Kegel exercises. What do you think happens? It gets even tighter. This actually weakens your erections instead of improving them. So if your pelvic floor is already overactive, Kegels will make things worse. Instead of helping, they'll increase muscle tension, restrict blood flow, and reduce erectile strength. Number 2. Hypertonic pelvic floor. According to the Journal of Sexual Medicine, a hypertonic pelvic floor can contribute to erectile dysfunction in men and painful intercourse in women. Just like any other muscle, the pelvic floor needs balance, not just strength, but also flexibility and relaxation. And it's obvious that constant contraction without relaxation leads to dysfunction. Number 3. Increased risk of pelvic pain and spasms. A 2019 review in the Journal of Women's Health Physical Therapy highlights that excessive Kegel training can lead to chronic pelvic spasms, leading to pain and discomfort. Imagine holding a fist tightly for hours. Your hand would cramp, right? The same happens with your pelvic muscles when overtrained. How to know if Kegels are right for you? Well, before you start any pelvic floor exercises, you need a proper examination. The best way to check if your pelvic floor is overactive is by seeing a specialist, typically a physiotherapist trained in pelvic health. Another important step is learning how to properly activate your pelvic floor. Many men don't even know how to correctly contract these muscles. Many mistakenly squeeze their butt, thighs, or abs instead. Also, women struggle with this even more. They can't activate their pelvic floor properly. So, if you can't control your pelvic floor muscles correctly, Kegels won't help. Instead, you'll need to start with basic movement awareness before attempting any strengthening exercises. Who should avoid Kegels? Now, Kegels aren't harmful for everyone, but certain individuals should avoid them or perform them with caution. These include people with tight or overactive pelvic floor muscles, those experiencing chronic pelvic pain, men with non-bacterial prostatitis or tension-related pelvic pain, and women with vaginismus or pain during intercourse. Who actually benefits from Kegel exercises? Now, as I said, Kegels aren't for everyone, but there are specific cases where they do help. Number 1, in older men, like above 70, 'cause muscle weakness naturally increases with age. Number 2, men recovering from prostate surgery. Number 3, obese men, 'cause obesity is linked to both weak and overactive pelvic floor muscles. If you fall into one of these categories, pelvic floor strengthening could be beneficial. But for everyone else, Kegels might be doing more harm than good. Here's the important question that you should ask. What causes an overactive pelvic floor? Well, there are several factors. Some of the common ones includes poor posture, sitting for long periods, chronic stress and emotional overload, shallow breathing, and heavy lifting like squats and deadlifts. So if Kegels aren't the magic fix, what should you do instead? Here's what you can do. Number 1, pelvic floor relaxation exercises. Incorporate diaphragmatic breathing, deep squats, and stretches like the happy baby pose. Number 2, strengthen the whole core. Engage in exercises that involve both contraction and relaxation, like Pilates or functional strength training. Number 3, shockwave therapy has also been shown to be highly effective in relieving pelvic floor tension. And lastly, consult a pelvic floor specialist. Okay, so at the end of the day, strong erections don't come from just doing Kegels. They come from understanding your body, fixing muscle imbalances, and improving blood flow naturally. Kegels are not a one-size-fits-all solution. In fact, doing them without proper assessment can lead to more harm than good. So, yeah. That's it. I hope you find this helpful. Subscribe for more science-backed insights.